This is the production branch of the Molnlycke healthcare complex in Karviná, Czech Republic, where the procedure pack disposable customer trays are produced. Procedure pack trays are packages containing disposable medical instruments that are assembled and packed in exact accordance with customer requirement. They're mainly used in operating theaters, and their purpose is to save time, simplify logistics, reduce the amount of waste, and improve patient safety. Let's explore in this film whether this is correct. What particular savings or advantages can be achieved in practice by using procedure pack trays? Time is a very important resource at a hospital, especially in the operating theater. Consequently, hospital staff must plan the capacity utilization of the operating theater as efficiently as possible. Simultaneously, they must also ensure the best possible care for patients. Let's explore now whether, where, and how time can be saved in the operating theater. Whether it's possible to make more efficient use of the capacity of operating theaters while increasing the number of surgeries and therefore improving patient care. Apart from time, aseptic procedures are another important aspect of work in the operating theater. Waste reduction also plays an important role. We'll therefore explore whether it's possible to further minimize the risk of contamination and the amount of waste there is in the operating theater. This is the orthopedic ward at the Hornická Hospital in Karviná. One of the most frequent surgical interventions at this hospital is hip replacement. Every year we perform 580 hip replacements, and patients have to wait, sometimes several months, for their operations due to lack of capacity. This is a situation that everybody would like to change. Is it possible to change this situation without increasing the number of operating theaters? Let's focus on one of the most difficult activities, the preparation for an operation. It's a repetitive, routine activity. Would it be possible to find a way of simplifying and shortening the whole process? A conventional preparation consists of the collection of those individual instruments that are specifically required for a certain surgery type. A nurse gathers individual components from different sites and storage areas. The nurse then verifies the instruments, contents, and expiration, opens the packaging, hands the instruments to the scrub nurse, and sticks reference labels from each instrument onto the patient's documentation. To ensure patient safety, procedures must be in full accordance with a so-called aseptic technique. Surgery preparation is a big responsibility. It's difficult and needs lots of attention. The scrub nurse and the circulating nurse must implement several crucial steps before surgery can begin. The tendency to use customized sets has been increasing over the past few years. Their main advantage is that one set, or tray, contains all the disposable medical instruments that are necessary for a specific type of surgery. This can be observed during this case, a hip replacement operation. A nurse brings a particular tray to the operating theater and checks the contents and expiration on the instrument stand. The nurse then opens the tray, and the scrub nurse immediately has all individual disposable instruments prepared for the intervention. Let's now examine the difference in time and the amount of waste between the two different individual methods of preparation, including the unpacking of the instruments. In operating theater 1, a typical preparation will take place using individually packaged components. In operating theater 2, a new preparation method will take place using a customer set. Time used will be displayed on a timer, and the amount of waste will be indicated on a litter bin icon. Operating Theater 2 is ready for surgery. Preparation, including the unpacking of the instruments, has taken only 4 minutes and 14 seconds. Only 1/10 of the litter bin has been filled. Meanwhile, In operating theater 1, the nurse is still preparing individual components. Let's fast forward the film so we don't have to wait so long. And using the conventional method, the actual time needed for the preparation of the operating theater was 14 minutes and 30 seconds, and the litter bin was full. Our demonstration shows a clear conclusion. Using a customer set, preparation time for the hip replacement surgery was 3 times faster than the conventional method. It really saves time in the operating theater. With a customer set, we can perform more surgeries annually. The difference in the amount of waste was also significant, 90% less when using the set. It's also very important to reduce the risk of aseptic errors. The risk of a nurse touching an instrument when unpacking a set is minimal in comparison to the conventional method. Let's summarize the results of our test. When using a customer set designed for hip replacement surgery, more than 10 minutes of time was saved. That means that on 12 hip replacement surgeries, we would save up to 2 hours per week. Nurses can spend the spare time on patient care. More time also means that they can concentrate more on their job, having to rush less. The amount of waste has been reduced to 1/10. The surgery became much more ecological. By reducing time and decreasing the amount of waste, the surgery's costs have also been reduced. The logistics have been simplified and improved due to the all-in-one concept, and time has been saved on material ordering and storing. The traceability of instruments and the inventory control have also been improved.